And welcome back. Very interesting gentleman on now, Dr. Jeffery Lee, and he is he serves as the medical director of robotics and minimally invasive cardiac surgery at the Memorial Care Heart and Vascular Institute at Saddleback Memorial Medical Center. Welcome, sir.
Thank you, Ken.
Nice to have you on. And reading a little bit about your background here, one of the things that's written in your bio here is you wanted to pursue your lifelong passion for robotics and minimally invasive cardiac surgery, and it looks like you certainly have done that. Tell me a little bit about what people have probably heard of this. It's been around for a while, but standard cardiac surgery, for lack of a better term, versus minimally invasive cardiac surgery, and then we'll get to the robotics part of it.
Well, standard cardiac surgery is a very safe approach that's been proven over many, many years, and that involves what's called a median sternotomy, using about a 10 to 12-inch incision in the midline, dividing the breastbone and getting access to all parts of the heart. That's a very safe surgical technique that I've been trained on traditionally in the 90s. But more recently, over the last 5 to 10 years, there's been new innovations for cardiac surgery that have allowed less invasive approaches. Specifically for heart surgery, as a heart surgeon, we treat primarily about 3 or 4 conditions primarily. Typically a heart bypass surgery where you bypass blocked heart arteries with better arteries from the chest wall or from the veins from the legs. Fixing or repairing a mitral valve, which is one of the heart valves of the heart, changing an aortic valve, and treating atrial fibrillation. Nowadays, there's actually less invasive approaches for all of those conditions that can get the patient back to their normal activities sooner, quicker, with less pain, and quicker recovery.
And we spoke right before we got on here that this type of procedure was really started, as I recall, back in the mid-90s. There was, I think, a couple companies that did that. And it's obviously progressed since then. It was really state-of-the-art back then, and I'm sure it is now. But you look back, we've now had almost 20 years of perfecting this procedure, right?
Yes, it has been a big evolution over time. More recently, I've been trained over the last 2 years in these techniques. Basically, my own history is I was a board-certified attending cardiac surgeon in Honolulu, Hawaii for over a decade. But I was feeling that I was kind of being left behind with the time, so I actually went out and decided to formally train myself over the last 2 years with formal fellowships at institutions such as the University of Maryland, where I learned robotic and minimally invasive bypass surgery, heart bypass surgery, and most recently last year at the Cleveland Clinic, where we did robotic and minimally invasive valve surgery. And that's, I think, the best way for a surgeon to adapt these new technologies. You hear a lot about, sometimes in the media, about new innovative procedures that may or may not succeed, but I think how it can succeed is not necessarily technology, but having an experienced surgeon going back and learning in a formal training environment and learning these techniques from world-class experts, and then bringing it to a local community like Saddleback.
Yeah, exactly. I think that's true in so many different fields, that as much of an advancement of technology that we have, I don't care what kind of field you're in, from being a doctor or working in computer graphics or things like that, but to have that base there of knowing you have that history of how it was traditionally done and being able to apply that to how it's done today. Tell me a little bit about the robotic part. People might hear that and they think, well, everything's kind of set up, the patient lays there, the doctor puts his hands up, and the robotics go in and do everything. That's not quite what it is it?
No. The robot is essentially just another tool that we use, as if a scalpel or a carpenter would use a hammer. A robot is just an enabling technology. Basically, traditional heart surgery, as I alluded to, you open the whole chest to get your whole hand and basically your whole head into the chest to fix what's wrong with the heart. But now, why not use small, little tiny hands which go between the ribs on the side here, and we put a small 3-dimensional camera inside between the ribs, not breaking any bones. and I'm sitting over there at 5 feet away at a console where I can really see inside the heart and figure out what's wrong and fix it. So we can actually perform pretty much, if not better, heart surgery with a closed chest environment than we could in the old days with a full chest open sternotomy approach.
And one of the main benefits is the recovery time, right?
Biggest benefit, I think, is the recovery time, but specifically for mitral valve repair, which is what we do a lot of, and we did a lot at the Cleveland Clinic, where we did over the last 5 to 7 years about 1,000 robotic mitral valve repairs without anybody dying, with really great results. But the biggest difference I found is the ability to repair the valve. When you're able to really immerse your whole, environment in this three-dimensional environment, you can really figure out what's wrong with the valve and repair the valve more likely, and the repair rate's in the 99% range. Where with traditional approaches or other approaches, the repair rate has not been that high traditionally. It turns out for mitral valve repair, that's the most important thing, is to being able to repair the valve. That leads to longer lasting survival.
Yeah, I could see one of the primary benefits here is, as you were saying, how you can really get in there and look, where before you're physically standing over there and looking in. Now, because of the miniature camera, you're within the environment, and you're looking at a screen, and it's as if you miniaturize yourself and can really see in there. But can this be done for all patients? Who would qualify for this versus where you say, you know what, we have to come in and do this the traditional way?
Almost all patients, I think, are a candidate for one of these less invasive approaches if they have only a single thing wrong with them. Unfortunately, many people have a mitral valve plus a bypass which needs to be done. That would not be a candidate for these types of approaches. If they have only a bypass that needs to be done, a heart bypass, a mitral valve problem, an aortic valve problem, less invasive approaches can be applied to almost all those patients. But if you try to combine different problems, then it usually requires a bigger incision and a sternotomy approach.
Okay, is that just it gives you the room to get in there? Is that the reason? Or because the way the setup you have to do, that it's very specific?
Primarily the whole secret, if you will, of minimally invasive and robotic heart surgery is strategic placement of the incisions. So the aortic valve turns out to be in a certain area of the body that if you could just make a 2 to 3 inch incision and get right on top of the aortic valve and fix it. But if you need to do an aortic valve and fix something that's way over there, that's another part of the heart that would not be possible through the 2 to 3 inch incision.
Okay. We talked about the benefits of this, the recovery time and all. Are there other benefits as far as is it less likely that the patient might develop some sort of an infection because you're working with an incision like this versus an incision like this and having the whole chest open?
Actually, where I trained last year at the Cleveland Clinic, they've done extensive research on this. The Cleveland Clinic, we do over 4,000 hearts a year, so you're really able to have huge numbers of patients to compare one approach versus the other. And I actually have a website that I created called www.miniheartsurgery.com, where you can actually download some of these articles from the Cleveland Clinic where they compared in a statistical manner these less invasive approaches or robotic approaches to traditional approaches. And they basically found it's really not the size of the incision, although that's what everybody seems to be focusing on, but it has real clinical benefits in terms of reducing pain, reducing time in the hospital, and quicker recovery time, and all those types of things. Clinical real parameters that make a big difference for the patient and their whole lifestyle after the surgery.
How long have you been over at Saddleback working with the medical center over there?
I just started there about 6 months ago.
And is this something, this technique, were they doing this before, or is this something you've kind of brought there?
We brought it. I brought it with my recent training and experience, and they never actually did it before. But I've been really amazed at how really good that medical center is. My history, I've been trained at really world-class institutions, but I would really say that the care there has been top-notch in every single aspect. They really are a really good institution. They're really just waiting, I think, for somebody like myself with the experience, knowledge, and I think the drive to really get this program, the cardiac surgery program, to a world-class level. I really think we're there right now.
And you mentioned you worked in Honolulu for how many years? Are you from
over a decade.
there?
No, my wife's from there, though.
Oh, okay. And when you came over here stateside, is this where you got the training for the robotics, this next step?
Yeah, like I said, I spent a full year doing robotic heart bypass surgery at the University of Maryland, where they have a big center that does that type of surgery. And that's basically using the robot to do the heart bypass procedure. And we use the mammary artery, which is the artery behind the ribs, to bypass the blocked heart arteries. And oftentimes we work with our cardiologists to do a hybrid approach. And basically, this cardiac surgeon, myself, would do the robotic approach with a 2 to 3 inch incision in the left chest, doing the bypass to the front of the heart using that heart artery. And oftentimes we would work with our cardiologists where they would do a drug-eluting stent to other blocked arteries. And that way we can get the best of both worlds, cardiac surgery, which is the bypass using the heart artery with a tiny incision, whereas the cardiologist would do the rest with a drug-eluting stent, because actually drug-eluting stents are getting better and better now. So I think that's the way to mesh really two great technologies and two great specialties, cardiac surgery and cardiology together, to benefit our patients.
Yeah, it sounds like it. What's the website again that you created?
www.miniheartsurgery.com.
Okay, that's easy. That's easy to remember. Well, Doctor, I find this really fascinating. I think this is to see this technology advance the way it has, in the fact that it's available just right across the way here at Saddleback is wonderful. And good luck to you. And thank you for bringing this to this area.
Thank you very much.
I think it seems to me it's only just the beginning, isn't it?
Only the beginning.
We can go. All right, I want to give you the number to Saddleback Memorial Medical Center. Very easy, as you can see there, 1-800-MEMORIAL or 800-636-6742, but just remember 1-800-MEMORIAL, and then miniheartsurgery.com. And for there you can get Dr. Lee's website. We can get more information about this. I find it absolutely fascinating. Thank you very much.
Thank you very much.
Nice to meet you. We'll be back in just a moment.
Family. Whatever you need, they've got your back. Like Memorial Care Health System, a family of healthcare providers. At Memorial Care, we're all connected. The finest hospitals like Saddleback Memorial, top doctors, medical groups, urgent care centers, in-store clinics, and more. No matter which one of us you visit, we're all up to date. We can keep you healthy and care for you when you're not, right in your own backyard. The family of Memorial Care Health System, investing in you.